Welcome back to another episode here on the Heart and Hustle podcast alongside Miss Allison. How you doing today, madam?
I'm good. How are you doing?
Listen, it is Monday currently. Father's Day just passed. So I would say it was a really good weekend. Got to enjoy a little bit of, I guess, what Father's Day may be, but I was still barbecuing. I was still doing all the good stuff that dads do. How is your Monday going so
Telling
far?
some dad jokes for you?
Oh, the kids are still too young for the dad jokes, but
Uh,
definitely going to be coming. They're 2 and 5, so the dad jokes for sure will definitely happen. Right now,
there's a
they
local
can
ice
wait.
cream place near us that we went to, and they said they would give you a free topping with every dad joke.
Really?
Yeah, yeah. I thought that was
Oh, man. That's
that's good.
actually what a good way of just marketing, to be
Yeah,
quite frank. Like, I can imagine people really showed up, wanted to take their dads there, or dad wanted to take his kids there, made sense. Wow, that's actually really good.
yeah.
So, let's let everybody know, Miss
Yes.
Allison, what organization you represent, what is your title with them?
I'm the president and CEO at Wood River Health, and we are a federally qualified health center or community health center, if you want to call us that, in Rhode Island, with a couple of locations in the southwestern part of the state.
Love it. How long you been the CEO president?
Be 8 years in September.
You ever thought that's where your life would bring you, Allison? CEO, president?
Not exactly. Um, Not exactly. I when I applied for the job in the summer of 2018, I kind of looked at it as a dream job. And they the board chose me. So
Here you
yeah,
are.
I've been very happy to be here through some good days, some tough times. There was COVID and coming out of COVID and all the other things in between. So it's definitely it can be it's challenging, but it's also really rewarding to be a community-based organization.
I love it. And then where was young Allison? Like she always knew she wanted to be in this space, or how did Allison even figure out that this is a space she wanted to be in so young?
Well, I'm not that young, but thank you for thinking. So I was raised in and was educated by the Sisters of Mercy at a local school here in Rhode Island called Bayview Academy, and the the Sisters of Mercy and the Mercy education stresses and emphasizes the Mercy values and the Mercy critical concerns. So the critical concerns include things like access to health care, um, advancing the cause of women, immigration, equity, the preserving the planet. So my from the time I was in fifth grade to the time I graduated high school, I was sort of immersed in this culture, and
Okay.
really it was driven home that it's important to whatever purpose you have in life, whatever it is you choose to do. And of course, it was highly encouraged because it was an all girls school for women to have a career and to seek leadership roles as part of one of the Mercy values. That I was just really immersed in that and it really clicked for me. And so, I wanted to find a career and a purpose that uh, kind of I felt fulfilled and felt like I was giving back and somehow contributing to the good of society. So I'd always had a passion for science and healthcare in general. And I, my belief is that healthcare is a right and not a privilege, and that the quality of your healthcare should not depend on the zip code that you live in, or your gender, or the color of your skin, or et cetera, et cetera. So that helped me to hone what I did with my with both my undergraduate and then my graduate degree, um, and led me on this path to where I am today, which is to lead this great organization that's focused on all those things. Right? I mean,
Yeah.
health centers at our core, at our mission, because we were founded during the civil rights movement, we were really created as organizations that brought healthcare into the local community and addressed the root cause of poor health. And the root causes of poor health isn't is certainly access to quality health care, but it's also the social determinants we talk about, right? Like food access, housing insecurities, literacy, et cetera, et cetera. So it's been really a great, this position has allowed me to both fulfill myself,
Yeah.
um, kind of intellectually stimulating, and be challenged, but also to feel like, I'm really contributing and the organization is helping the community in which we live.
So, did you graduate high school and then just kinda get into this line of work?
So I after high school I went to college and thought I wanted to be a doctor. Uh Kind of go a more traditional
Yep, yep.
route that way. Uh Organic chemistry kind of did me in a little bit. That was a tough one. Um and after college I did have a science degree and learned pretty quickly after I graduated college that I didn't really want to work in the sort of the core science field, like at a bench, at a lab bench, right? That was what I was doing right after college. Because at the time I was working for the university, I could take classes for free, and I took this class that was about health policy, and something sparked, right? And then I kind of adopted a mentor, the professor of that class, and he kind of talked me into pursuing the Master of Health Administration, and that's kind of how I ended up on this path. And
I love it.
most of the folks I went to graduate school in the 90s. Most of the people in my health administration course were focused on hospital administration. I wasn't really looking to go that route. I was really interested in working more on issues and policy for low income populations and people with disabilities. So that's kind of what led me to be working at both a Medicaid managed care plan as well as the state Medicaid agency. Um, and
I
then,
always say one
yeah,
person, could be one moment, one story that changes your life. There you go, Allison. You had a professor that really kind of changed the
yes,
trajectory of how you end your career or start your career per
yes.
se. You'll be happy to know that I actually went to the doctors, and I
Oh,
say that
good.
because as men we just don't go.
No, you don't.
But when they
We should every year.
yeah, the doctor says, "So what brings you in?" I said, "My wife, actually. My wife is the reason I'm here." But it was really because she's seen something and she's like, "Hey, you gotta take care of it yourself." I'm a dad, 2 young kids, very important. But I tell you that I came home and I loved where I went, so I started to share the news to my neighbor that was also because I told him I was going, so, "You know what? You're going." And he's older than me. I'm 36, he's about to be 50. But because I said something, he says, "You know what? I'm gonna go as well." And then I told him about the clinic I went to, and he was like, "Wow, just you talking about it, man, like, I gotta go there." So important the experience that we have when we go to these,
Yes.
places. It's important. I've been to also another space where I just felt almost rushed. I felt, almost unwelcome, really because it was just a bigger establishment. But I feel like what you're doing is that experience. It is more of is it a smaller, like, how many patients are you guys seeing on a daily? Like, what does that actually look like?
So it depends on your perspective. I mean, where you are, you're in a much bigger city
Yeah,
than we are.
100%.
So you probably seem pretty small. But last year we saw about 12,000 patients. And that translates into about 35,000 primary care visits and another 7,000 dental visits. And we also do some behavioral health, so another 6,000 behavioral health visits. Um, like you said, healthcare is personal, and your relationship with your personal provider is it's important, and there needs to be trust there. And one of our core values as an organization is respect. And we
Yep,
want to respect, of course, each other as people and colleagues, but also respect our patients. Our patients all come from different backgrounds, different experiences. Our job is not to judge them, but to really help them, give them accurate information, right? Not misinformation like they might see
yep,
out there. To give them accurate information and really work on a care plan together, not a one way. The doctor telling you what to do. It's got to be we're a patient centered medical home, and what that means is that the patient is at the center, so that when you're developing okay, maybe you have a diagnosis like diabetes. Okay, let's talk about what you're going to do, right? How can you adjust your diet? How can you add exercise into your life? What works for you? And not coming from a place of judgment. Uh, so that's I think the differentiator for us.
yeah, I love it. Really being able to educate them and also provide a really good experience, around it all as well. I think it's really
Yes.
important as well, and
Yes.
giving someone a safe place to go, that's more than anything, because if you don't feel safe, you don't feel comfortable, everything you just kinda mentioned, right? I'm not going to go at all, or
Right.
I'm going to find somewhere else to go. And a lot of times it's just they don't go at all. And I think for me, the last time that I actually went was like 3 years ago. And I would tell you that the experience that I had there,
Yep.
I was kind of, I don't know if I wanted to go back, right? My wife ended up somewhere new, so that's how I ended up there. But yeah, it definitely does make a huge difference, in how we take care of ourselves as well, because we wanted to be
Yeah.
trusted,
Yes.
right, with the
Yes.
information that we have, but also know that
Yes.
someone really cares about our health as well, and it's not just
Yeah.
about another dollar.
Yes.
And you guys offer so much, really leading to you care about a lot. Is this purposeful because that way you can get everything done at once? Is that the reason you guys kinda tapped into all these different
Mm.
markets?
Yeah, so health centers, all health there's 1,400 health centers across the United States, with about 12,000 different delivery locations, and each of us, there's a core set of services that we all provide. So that includes the primary care, dental care, and then behavioral health. So then from there, community health centers can add on other specialties or add on other service lines. So for us, our behavioral health treatment is not just mental health, but also substance use disorder treatment. We have a lab here on site, so when our providers order, blood work, um,
Yeah, it's good.
go get your blood work done. It's really important. The lab's just down the hall, right? We have a pharmacy on site, so it makes it easier for patients. If they come in for a sick visit, they need to go pick up a prescription. It's right there. They can go grab that. We have a physical therapy provider in our building. And then because transportation is a big barrier where we live, we don't really have public transportation in our part of the state. And as everybody knows right now, it's very expensive to own and maintain a car and put gas in that car. We
Yep.
don't want that to be a barrier to people coming to see us, or that to be a reason why they don't go. So we have a couple of vehicles, and we employ a driver through some grants, and he picks folks up and brings them to our facility for their appointments. So
Love it, can't get any easier than that. Addison, 8 years ago, you said you started this journey, as a CEO and president. Where were you guys then? Where you did you want to be, and where are you guys today?
so we were quite a bit smaller. In 2018, we had one location, and when our board, one of the first things the board said to me was, "We need to expand and open a second location in a town not far from here." But Rhode Islanders we're kind of funny. We don't like to drive far. So
Okay.
anything further than 20 minutes is like, oh no, that's too far. I can't go there. So we did open a second location in 2019, about 20 minutes away in another town. But it is the town where about 30% of our patients actually come from and live. So that met a huge community
Yeah.
need. Um, so with the expansion of the space, we also added more clinicians, more PCPs, more RNs, et cetera. Some of the services that I just mentioned, like the van, that we didn't have that in 2018. We weren't providing substance use treatment really in 2018, so we added that. We became a LGBTQ safe zone. So to your point about feeling safe, that's sort of a designation that one of our local Blue Cross plans provides to us. So we did that. So adding staff, adding locations, adding some services, and increasing the number of patients. When I started here in 2018, we saw about 6,700 patients that year. And like I just said, last year we finished with about 12,000 patients. So we've definitely grown. One of the other changes, and then COVID actually stimulated a lot of this, right, is the move towards technology. Telehealth isn't used as much as it used to be used, but it is still a really good option for people. We get snow in our part of the country, not so much down where you
Yep.
are. But this winter, I mean, we had a blizzard, literally a blizzard. And so one of the days we were able to still see patients, right? Patients can't get here. We couldn't get here. But as long as the Wi-Fi was working, we could do some telehealth
Yeah.
and see some patients. So that really removes a barrier for a lot of folks and opened up, some good options for people. So that's a big difference, right? We weren't doing anything. Nobody was, not really, doing telehealth before COVID. And like I said, it's not used as regularly as we did during COVID, but it's definitely a good option for us.
Yeah, telehealth is, I remember I didn't experience it, but my wife, when she was pregnant, was experiencing it because it's during COVID as well. You weren't always just able to go to the hospital, so there was a lot of, virtual visits. And even with the kids sometimes, when something's happening with a kid,
Yep.
you're not always having to go. Like, okay, the doctor's going to call you at 10 o'clock, just be prepared.
Yep.
And you're on video call with the doctor. Like,
Yep.
what times have changed? And then now we have AI, right? I can
That's
imagine that
another big
there's also
change.
some
Yes.
innovation around there.
Yes.
Where are you guys?
So we're I wouldn't call us early adopters, maybe fast followers on certain things. The
Okay.
first thing we did with AI, we're always looking to, like you said, the patient experience is really important. The provider experience is equally important. We want to make sure our providers are, we want to retain them because if we don't have providers to see patients, we can't fulfill our mission and meet the community need. So one of the first things we did with AI is use something called a AI scribe. So you might
Okay.
have seen this because a lot of practices are using this now.
Yep, yep,
So instead of the doctor like staring at the computer typing right while they're talking to you, the scribe that is got ambient listening happening in the background, and will take the whole conversation and create a note that the
yep.
provider can just drop into the chart. QC it, you know, but it's pretty accurate from what the providers tell me, and it helps them to have that more face to face as opposed to looking at the computer and typing, and saves them hours of charting every week. Hours,
Yeah.
not an exaggeration. So that was sort of our first step into using AI. And so we're starting to look at what are some other tools that we can use. Some folks are using it for like phone room. Potentially we could start to think about that. Is there some AI steps, to help you, an AI
Yeah.
patient service rep before you get to the
Mhm.
human?
Yep,
Um,
yep.
so we're
I think
exploring some other
actually
things.
I called the hospital the other day to set up my lab
Mm,
because my place doesn't have a lab inside of them, Allison. You know what I mean? They're not as high tech as you guys. So I had to call, get the lab, and they exactly did that. It says if you want to speak to AI rep, press this button. If you want to continue, press this button. So
yes,
now I'm actually experiencing some of that. But even to what you said, back 3 years ago, before AI was really as what it is today, the doctor that I seen was straight into the computer, just having a conversation to the computer, not to me per se. And I'm literally trying to conversate with her, and
yep,
she just kind of going through the list of things.
yeah, yeah,
Then to find out that that wasn't even the same doctor, because I was like, hey, I think you see my wife, and she's like, yeah. She was just kind of like BSing me. My wife's like, oh, that wasn't my doctor. So I'm like, oh, she was just trying
sure.
to get me in and out of the building.
Mm,
But then this other doctor that I just seen, it was like we were homies, Allison. Like I truly, and probably because she had the exact what you mentioned, that transcribe on the back end, it completely becomes a different game because I feel like I'm actually talking to somebody. But I get it now, right? It was just so much work, and I love that AI could be of assistance, not to take somebody's job, but
exactly.
really allow them to do more of the things that they love.
That's
And
right.
I think that's where people kind of forget that's what AI does. Of course, there's wrong ways of using it and X, Y, Z, things like that.
Yes,
But I love, Allison, that you guys are finding those really good ways that allows the workers, and the staff to get back to the things that they went to school for, that they
yes,
love, that they have a
exactly,
passion and purpose for.
exactly.
But I kind of want to take this away from
Mhm.
just the healthcare a little bit because I'm looking at all these action figures and I
Oh,
kind of
sure.
see there's football back there. It
Yes.
might be a little bit of soccer. What is back there? What clearly there's a
Uh,
reason they're there.
yes. So, we're in New England Patriots territory up here.
Okay,
So
yep.
I've got some Patriots figurines. I've got a little Tom Brady bobblehead.
Okay.
Uh,
I was wondering who was a bobblehead.
that's
Okay.
Tom Brady. And then my favorite Patriot is Teddy Bruschi. He retired from the New England Patriots. Now he does some commentating. So he's the guy with
Got it.
the motion there. And then let's see. Also behind me, I've got a little figurine of Ruth Bader Ginsburg.
And
So
is that a judge? Is that what that's behind your head?
well,
A
that's
judge?
Ruth Bader Ginsburg.
Oh, that's what it is.
Right,
Okay,
from the
okay, okay.
Supreme Court. And then the other guys they're all football guys. They're just little football figurines.
Okay, I didn't know if there was some
Yeah.
soccer because soccer
There's
was
no so
going on. Like,
there's a lot
are
of
you watching
soccer
soccer?
happening around here right now, that's for sure. Yes, a lot of
Yeah,
World
yeah. Do
Cups.
you watch soccer?
I have not been watching soccer, no.
Me either. Yeah,
The way
either.
I look
No
the way
worries.
I look at sports is there's football season and then there's the in between football season. So, we got camp happening, right? Football
Yeah.
camp, so we
So
can
you're a big football fan. Are you going to the games when you can, or?
Sometimes we go to the game.
Wow.
We're very comfortable on our couch watching the game, but our, Sunday plans revolve around what time the Patriots are playing every
Oh,
week.
yeah, I love it. Outside of work, what is the thing that keeps you really grounded, keeps you leveled, that brings you peace? What is that thing, Allison, that people may not know?
Um, I try to we use don't use the word work-life balance anymore. We use the phrase work-life integration.
Yeah.
Um, and so the role I have, which is pretty outward facing, public facing, brings me out into the community a fair amount, keeps me out of the house, sometimes evenings, weekends. So when I have that time to just be home and just be with my family, with my dogs, 3
Yeah.
dogs.
Kinda dogs, Allison.
So I've got a golden doodle. He's the old
Okay.
man of the group. He's about almost 13. He's starting to slow down a little bit. Then we've got a rescue mix in the middle. She's about 11. And then I've got a Wheaton Scottish Terrier who's 5.
You gotta live with everything.
Well, a lot of variety, a lot of variety. The girls keep the old man young, I think, keep him on his toes. But yeah, I mean, I think that just I like to I like to meet new people. I like to new experiences. Kind of a musical theater buff fan, so I like to do that. Then football, which we talked about.
Were you
So
a theater kid?
I was a theater nerd in high school.
Yes, me too, me
Was
too.
Yep, yep. Not so much the plays, but the musicals. So
Listen, I did both actually. I seen I'm not really sure what it is, but it is a Broadway awards show that they just recently had. Pink was hosting it or something, and she did a, Chicago segment,
oh, it's a great
All That
show.
Jazz, is what
That's
she
a
was
great
doing.
one.
And I remember being in
Right.
chorus doing all that jazz
Yeah,
and
yeah,
just the dance and all that good stuff. I was in drama, so actually it was pandemic time, so I already out of high school, but I got to do my first stage play as an adult. And how nervous but exciting that was working with
yeah.
some young kids and even older people, and me never thinking that I would be able to actually do this, but loving it. I truly love being in front of the camera. I guess I do that now, but it's cool. I would say theater really made me become a different person and be myself, more than anything. So,
Well, the arts are
Allison,
important, I mean, and when we look at, sort of back to healthcare, when we look at what are some alternative ways that people can be healthy or to express themselves, through mindfulness or, approaches to mental well-being, art and expressing yourself through art can be very powerful and can be very healing. Um, so
yeah, I love it. I enjoy it. I was actually going to take an improv class here this weekend, but I ended up doing something else. But really tapping into that. People don't realize actually like improvising, we use it every single day. I think we're all improvisers in some ways. And when you can really tap into some of those things, it makes you just a better leader, right? A better just individual. I would say, Allison, what are some of the things you going from probably not knowing anything a president and CEO is doing,
ugh.
then you get this role.
Ugh.
What are some of the things that you had to do to make sure that you were also investing into yourself?
Yeah, I mean that boundary setting, I think, is important. I can't be everywhere, uh, all day, every day. There's things I have to say no to just because I get to have a personal life. I get to have downtime. I learned that pretty quick because you can burn yourself out. You really
100%.
can burn yourself out.
Yeah.
Um, I've learned a lot about leadership. Uh what to do, what not to do. I see it as I always when I talk to folks about leadership, to me it's a journey. You're always learning. You're never quite
Always. Yeah.
there. You're always kind of on the road. So I read a lot. I like to read, and I like to read fiction and historical fiction, but I also read books that help me to just understand myself better, understand working with other people and how to lead them and be better at doing that. The psychology of people, the psychology of leadership. I mean, this it's fascinating. I mean, there's so much you could really dig into.
If we talk about leaders, is there a something that resonates, like a leader told you that still is there, always comes to mind? Mines would be like, listen more,
Yes.
talk less.
Yes.
Well, Allison, what is yours
I
that comes
100%
into
agree with
mind?
that one. Yeah. You've got 2 ears and 1 mouth. Listen more, talk less. Uh, early on, I had a mentor, boss, leader tell me that, when you're looking to make change or make decisions, you should always talk to and involve the people that are at the front line doing the job, right? Because
Yeah,
they're the
I love
ones
it.
who know best how to improve upon whatever it is they're doing, right? So I'll use our front desk as an example. I don't work at the front desk. I don't check patients in and out every day, all day. They do. So it's important to talk to the people doing the job before you start to say, oh, we should do it this way. We could do it better if we did this. You really have got to hear a change. Sometimes change has to move fast. Like during COVID, we had to make some snap decisions and move
Yep.
quickly, but you've got to pace change in a way that brings people along with you and understand, the rationale for the change, the need for the change, and make sure people have a voice.
And what is that leadership advice that you're giving people nowadays, being in the seat that you're in?
It's that certainly that advice that I just mentioned. I think that leadership positions can be somewhat isolating, right? You
Yeah.
have to be careful and cautious that people are watching you and paying attention to what you do and what you say, and it's important to really be equitable and fair. I mean, you've got to not play favorites. You've got to think about the whole organization, not just what's good for this one person or this one group, because we're an ecosystem, right? We all need each other.
Yep.
And you also have we also it's important to build trust in a team and maintain that trust and keep working, as a team, right? I can't do this. I tell people all the time, I'm like, I can't do this, whatever it is, by myself. I need the team.
Yeah. I jokingly, realize how much I pay my staff, right? I have like a staff of 4, and like I was like, I can save money and I could just let them all go, right? Jokingly saying that, and then my neighbor said, like, yeah, just you're right. Like I would just save all that money. I said, but best believe if I was to let them go, the work doesn't get done because there's no damn way that
Right.
I'm not as good as them, to be quite frank. First of all, I wouldn't even have the time to think about some of the things that they do. It is so cool to be a leader, hire people that you know are really good at what they do, and allow them to just own it, authentically them, right? I think there's
Right.
something cool about that.
That's right.
What is a stigma you think, Allison, that people are having that conversation or believing out there that is not true that you'd want to kind of set the record straight?
Sure. So I'll address two specific things about community health centers, which is where I do this work every day. One myth is that community health centers, although we were founded during the civil rights movement and initially created for to provide access to people that didn't have health insurance or access to health care, we serve everyone, right? Whether you have insurance, don't have insurance, low income, wealthy, doesn't matter. And we have all kinds of patients. So I think there's a myth that community health centers are only for low income patients. That's not
Okay,
the
that's a
case.
good one.
Although
Yeah.
that is the core at why we were founded. And then the second myth that often goes along with that is that when you get care at a community health center, you're getting lower quality care. So I have this little slide that I show people with all of our quality awards. When I do
Yeah.
presentations, I call it our brag slide. That that myth. I always tell people that's really the farthest thing from the truth you can get because we submit so much data on our patients, aggregate, right, to state agencies, to the federal government, et cetera, et cetera. And we are judged and ranked based on our performance. How well are we taking care of our patients, right? Are 30 something year old men coming in for their physicals every year like they're supposed to? Are
Yeah.
women getting mammograms? Are kids getting vaccines? Are et cetera, et cetera, access to prenatal care. And based on our performance, we've gotten the Gold Quality Award for 3 years in a row, which is the highest quality award you can get from the federal government for healthcare. And only 10% of health centers in the United States get that award. We've got it
Come
3 years
on,
in a row.
Allison.
So, so you can't get better quality. You really can't.
That's so good. No, that's really good things to call out because both of them I actually thought, right? Not so much more of not having quality there because I've actually had to learn that. Like that's not true when we talk about passion and purpose. People just want to do the things that they
That's right.
love at whatever level they do because it's not about the money. We talked about that. So yeah, that's pretty cool. But the one of that you guys only take those that may have Medicaid and or
Right.
may
That's
not
right.
have insurance, all that. I appreciate you kind of clarifying that. Where can people find more information about what you guys are doing? Or is there socials?
Yeah. We our website is Wood River Health, all one word, woodriverhealth.org, and we're on Facebook and Instagram and LinkedIn. Uh, so and people can find us there.
Are you active on LinkedIn? Are you checking your messages if people want have questions?
Yeah. Yes.
All right, I love it. Well, Allison, I really do appreciate your time here. I want you to get back to work. I can imagine you're a busy person. So we thank you for all the insights and what you guys are actually doing at Wood River Health and all the amazing work that you've done and are still planning to do. I can imagine there's a lot more to come as well. But these are the conversations that we're having with leaders in your own backyard. So guys, if you guys want to make sure that you guys are tapping in, go to the websites, go to the socials, but also just follow them on LinkedIn and kind of look at that journey. If you have any questions, all these leaders are always willing to give insights. And one thing I realize about a leader is that people feel that they can ask questions, so that maybe we're not personable or whatever that may look like. And I think Allison, I've heard something. It's like we always willing to have a conversation if you ask.
Yes.
And that goes even for our internal team. We're always willing to have that internal conversation if you ask, because there's so much insights that we have. And as you mentioned, as entrepreneurs, as leaders, as just professionals, sometimes it is a very lonely world, and we'd love to talk to you. We'll love to answer the whatever questions, whatever myths you think's out there. I can imagine Allison is ready to debunk them all. But Allison, we thank you. For those that are watching, make sure to share, subscribe, and also like. I'm Efrain. This is Allison. We'll catch you in the next one. Later.